Hi, folks. My name is Dr. Joanne Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges. Very excited to have you all with us here today. We are going to be giving you a snapshot of some of the sites that will be hosting residencies in the upcoming cycle. So with that, I know some of the students or slash residents are still coming into the space here. Next slide. So everybody is in listen only mode. We do encourage you all to use the Q&A function for any questions that you may have. There is a chat you'll notice as well, but Q&A just makes it a lot easier for us to manage the questions on our end. So if you could please use the Q&A for any questions that you may have. You also may, during the course of today, as folks are speaking, you feel free to direct chat a site that you are interested in while other sites are going. You don't have to wait until the question and answer section to begin asking some questions. So if you do have questions specific to a site that is here today, feel free to either put it in the Q&A and or direct chat the folks so that we can get your questions answered as promptly as possible. So with that, next slide, please. So this will be recorded. And any questions that you have and post may be publicly available. So just want to let you all know that. And this is not for CE or anything of the like. This is just informational. Next slide. So we are going to cover a quick timeline, just a little reminder. Hopefully you have calendar invitations set up for all of the big deadlines already in your calendar. And then we'll jump right into the site presentations and go through the Q&A and some breakout rooms. Next slide. So just a real quick recap. We are right in the preparation period. So congratulations for doing the prep work, the legwork needed to make sure that you put your best foot forward. We are also tell folks right now to be reaching out to sites for preceptorships. Any types of informal reach outs are very welcome and appropriate at this phase of the game. So the application period opens February 1st. That means that you can actually submit your entire packet. So if you want to just be able to jump right on that, be working on your faculty evaluations now, all of those things are things that you can be working on, your personal statement, making sure your transcripts are set. So those are all things where when February 1st comes, you could potentially press send on your application right then and there if you're ready to go. All of these deadlines, by the way, are computer generated. So when the time closes, the actual portal closes. So just be very aware that these are hard deadlines. And we do hear from students every year, oh, well, I got the time zone confused, or I didn't realize when it was due. And so please just recognize that these are system deadlines. And so when the system shuts down, you're not going to be able to submit afterwards unless you send an appeal, and then that's going to have to, be processed potentially, and it may or may not be accepted. So then we move into the interview and match period, and definitely encourage you all to contact your career centers so that you can best put your practice interview skills to boot. And then we will host match on the 24th. So with that, we're going to jump right into the sites. So the sites with us today, I'm not going to read them all out. You can read those. They are in alphabetical order. So again, if you have a question for a specific site, especially if they're later on, feel free to direct chat them during the course of this. So Ames, you're up. Ames Institute. Okay, let's go to the next one, Angela. All right, advanced, whoops.
Greetings. This is Jashar Rentz. I am the co-owner of Alpine Integrated Medicine. We're here in Redmond, Washington, and our clinic was is co-owned. by Dr. Brooke Rentz and myself. Dr. Brooke is the founder, medical director, brains behind the operation, and the engine that caused our clinic to grow into what it is today. We've been around for 15 years in our current iteration here at the clinic, and Brooke's been practicing for nearly 20. The cool thing about our residency, I think, is that we have a very collaborative model. We try to really have a full integrated, truly integrative clinic. And that includes a lot of different modalities. So in addition to working with Dr. Brooke Rentz, we also have some pretty incredible practitioners for a potential resident to learn from, including Dr. Greg Robertson, who's our IV director. He's worked and run IV rooms everywhere around the Puget Sound, all of the major notable rooms. And in his experience, he's finally come here. He's done some work to revamp our IV program and does a lot of really cool injections and is probably our most naturopathic of naturopathic providers. Dr. Sabrina Kimball has a focus on GI and chronic conditions, including hypermobility disorders. Dr. Lisa Price is a almost 30-year vet in the naturopathic community and leads up the integrative oncology side of the clinic. And Dr. Randall Carpio is focuses in on the fitness, weight loss, and athletic performance side of things. We do primary care, men's and women's health. You can kind of read the slide. The big thing that we do, I would say, is stuff under the umbrella of longevity. And the newest thing that we're rolling out in 2024 is a new kind of like wing of the clinic, if you will, where we're focusing on holistic aesthetics. We just brought in a nurse practitioner who also kind of helps to round out the integrative feel of the clinic and is going to be doing some injection therapies for aesthetics with us as well. So that's kind of what's going on. I guess the other big thing before we move screens real quick is that we use and I know the word has a lot of meanings. We use a concierge model, which is essentially a way for us to help pay for non-covered services while still accepting insurance. So that's kind of the big picture of our clinic. Go ahead, next slide. We are busy and we are looking for a person who wants to be busy and who really wants to, lean into the robustness of the work here that we do. Oh my gosh, my video's not on. Now it is. You can see that I'm in my car because I'm at my kid's basketball game right now. That's all about that work-life balance, right? Anyway, you can expect a 5-day work week with additional duties outside of clinic hours. You can expect significant patient contacts, both as a primary doctor and as medical support. You can expect a lot of collaboration, communication, and dedication to the clinic, our patients, and the work we do as physicians. And you can expect to be asked to take initiative and leadership and ownership of your work and practice. We're really looking for a resident who is, honestly, who really feels like they almost don't need a residency, right? Who really feels like they are ready to go and ready to hit the ground running. That's the kind of person that will probably do the best in a residency at our clinic. And someone who likes to both take, can take direction, right? But takes initiative, takes ownership of their work and doesn't require, I don't like to use the term hand-holding, but, doesn't require as much of that as kind of a self-starter. That's sort of our ideal candidate. Next slide.
And Dr. Rentz, just a little heads up, we do want to wrap it up soon. Thank you.
Sure. 10 seconds. You can read the compensation. We're trying to compensate robustly for a resident because we're asking for a top person that is ready to roll, and we are ready to compensate accordingly. So it's 65 base, 3,600 healthcare stipend, 2 weeks paid vacation, 10 clinic holidays, retirement account with corporate matching, all the various costs paid, CE, in-house discount, and that's what we're trying to offer. Next slide. If you have questions, hit me up. I'm happy to talk to you about it. I will just say this: if you want to be a resident at our clinic, the people that tend to get selected have also done some kind of preceptorship. So I would reach out to me if you're interested now, so we can connect you with Dr. Brooke or one of the other doctors so you can come in for a little visit. Thanks so much.
Awesome. Great. Okay. So Bastyr.
Dr. Roth?
Okay, so we'll keep going for now. We'll see if we're able to get Dr. Roth on a little bit later. All right, collaborative natural health partners.
Hi there from Connecticut. I was bumming to see Dr. Roth. She and I did an info session for naturopathic medical school. I'm going to waste my time talking about that. Anyways, I am from Connecticut, which we have a different scope of practice. We're covered by insurance. We can order lab work and imaging, but we do not have a full scope of practice as far as prescriptive rights. So how we've worked around that is working alongside osteopathic physicians and APRNs. So we have a really cool model where it's a hybrid of us practicing on our own, and then we also have the benefits of functional medicine, IV therapy, bioidenticals, and compounding, things like that, by working alongside osteopathic physicians who are actually trained by myself and one of the other naturopaths in the clinic in functional medicine. So it's this neat synergy between conventional and our medicine that works really well. I started the practice in 2009, and now you can see there's a bunch of us. The Christmas parties are really fun. You go to the next slide. So the experience, I kind of backed it into the expectations kind of are there that you're going to be a clinician, you're going to be working with all of us, but typically you're going to have a different doctor. So how we have it set up right now is you practice 4 days a week, and then you have an admin day 1 day a week, and every day you're with a different clinician who's overseeing you and working with you on different modalities. Based off of your interests, we can kind of tailor which people you would work with, but we have clinicians, most of our NDs have been practicing at least 10 years. We have ones that specialize in cardiovascular and GI and oncology, autoimmune, I mean, the gambit. So, we have examples of, doing biofeedback or learning various other things. Because of the relationship we have, 5 or 6 of the naturopaths in my clinic are actually medical staff at the local hospital where we are allowed to do inpatient. And we also work really hand in hand with a lot of clinicians in the area. So you end up doing rotations. In this case, this one resident chose surgical rotation, which is really cool. She did a rotation with a midwife and cardiology, but you can pick kind of your interest because we have a network of a hospital to be able to pull from, which is really exciting and cool. So again, like it's about the residents' interests and finding the relationship between the, like, okay, it seems like culturally you would fit, like we really focus on patient-centered care, eager to learn, committed to improvement. So that's kind of like our culture as a group. And then from there, like, where do you want to learn and grow as a practitioner? So that's kind of how we work. So the typical day is anywhere from 12 to 16 patients a day. We hustle on our days that we're seeing patients. And we use EMR or everything electronic, ordering labs to getting them and everything else. So you can do your admin day at home too, which is nice. That's typically the work day sort of thing. You can do the next slide. I'm trying to remember my slides now. It's a while ago. We do a lot of outreach. I think that's very important. Docere, doctor is teacher, right? So this year was our podcast, which was super fun. We're invited to do a lot with the hospital and working with the other doctors. So there's things that way. And was usually do a lot of CME as well. We just finished going to the New Hampshire conference. It's always really fun. Connecticut has a great conference. So there's a lot of education that's involved with this residency as well. We do grand rounds as a group. So all of the clinics come together. We have 5 locations. They all come together once a month. The residents are expected to either do a case report or a presentation on a topic. And then we will discuss topics. It depends on either we do a deep dive on something specific, like latest and greatest on osteoporosis, or we'll have, specific goals or topics we aim for. So it's a very dynamic, active group. Everyone really likes working together. And really, again, it's about this working as a team, leaning on each other. It's really a great place to work from that perspective. I think next slide. I don't think I ended up doing a slide around compensation, but if you're interested in that, please ping me and I can make sure I get all that to you. These are, again, because we have 10 naturopaths and functional medicine doctors, we have a lot of different modalities. So it's really about, you can get exposed to all of this or specialize in specific things. It kind of depends on your interest level. We do expect 3 1-week rotations outside of our office. Like I said, you get to kind of pick the modalities and we work with the clinicians, but that's kind of a unique thing with us as well. We are very committed to having people learn a lot while they're here. So you start out maybe with like 6 patients a day. We don't hose anybody with a whole full 16 patients out the gate. And you build up your panel. And the goal would be ideally is to have people stay on as clinicians and as associates. But we certainly have had some people find other locations after this. They come to Connecticut for us and then go somewhere else. So yeah, that's kind of us in a nutshell.
Thank
Thanks
you,
so
Dr.
much.
Young. Thank you. Sorry, we're at time.
No, we're
Thank you.
good. Perfect. Thank you.
Awesome. Okay, great. Envita Medical Center.
Awesome. Well, my name is Dr. Dan Warren. I am the co-residency director at Envita in Scottsdale, Arizona. We've been doing our residency now for about 4 years as well, and it's grown kind of organically. We started kind of one resident a year, but our motto has always been, we're looking for the right candidate. So there's really no cap on how many residents we have each year. We see kind of specialized, more niche, complex late stage disease, especially Lyme disease and cancer. So late stage cancer and Lyme disease incorporates a lot of chronic infectious disease, but those are the two main modalities that we see. It's very individualized, very personalized, very much an integrative practice. So we utilize all the great naturopathic modalities, of course, as well as a lot of conventional medicine in more specialized ways that are going to be more effective, as well as less toxic to the body. So mostly what we do is intravenous care, but like I said, we utilize all the naturopathic modalities, and there is opportunity for the candidates, depending on what your interests are, to utilize those modalities. So for instance, I specialize in homeopathy, so I use a lot of homeopathy with my patients. We partner with Verticis Compounding Pharmacy, as well as Envita Interventional Radiology, to provide specialized treatments to our cancer patients. We have a clinic down in Mexico, as well as our education branch, which is Naturopathic Medicine. So in terms of the residency itself, it's designed for collaboration. I think we're up to 16 naturopaths, and we're all in one office. We're constantly talking about cases and keeping it light in the office because we see such acute pathologies, which, as you can imagine, is a great learning experience for the residents. So next slide, please. So I usually will tell potential candidates that, I learned more in my first 3 months at Envita when I started than I did in, 2 years of residency. So because of the acuteness of the patients that we see, the learning opportunity is really, really great. So the first 6 months of the residency is mostly shadowing and, getting some hands-on training. We kind of take residents along slow just because it is really, really tough cases that we see. So we try not to throw people in the fire right away, which is a good thing. But obviously there's more opportunity towards the end of the residency to have your own patients and have more responsibility. So other responsibilities, there's treatment review board, research opportunities, on call. Of course, that doesn't happen right away as well. Next slide, please. Our goal is to grow our physician department. So we are fairly picky, to be honest, in terms of who we choose, because we want to have candidates that potentially can be with us long term. So we've had all of our residents stay, which I think is a testament to the residency program. In terms of some compensation, real quick, you can see between 50 and 60,000 per year. They pay up to about $1,000 for CMEs, medical, dental, vision, life insurance. There's retirement, PTO, holidays, and then they pay for medical licensing, certificate of dispense, as well as DEA, which is nice as well. So next slide, please. So in terms of why I would advise you to apply and to look into Envita, because of the types of patients that we see, where we see such acute pathologies, very sick patients, there's a great opportunity to see a lot of healing in our patients, which of course is why we all do what we do, is to see patients heal and get better. The learning opportunity is incredible as a result. So again, you learn more in our residency, I think, than a lot. And it's one of the better compensated residencies. I'm sure all of the residency directors can say this, but the staff that we work with are truly incredible, and it really makes a great working experience. So thank you.
Thank you, Dr. Warren. Appreciate that. Okay, great. So family health centers, we're ready for you.
Hey everyone, I'm Dr. Logan Rost. I am a current provider at Family Health Centers, which is advanced naturopathic primary residency. Next slide. So we are located in North Central Washington, which is a very rural area. So in terms of candidates, we're looking for candidates that have already completed a first year of residency elsewhere in a primary care setting, and who are interested in doing primary care in a rural setting. It is a 2-year residency, so you're essentially coming to us for both your second and your third year of residency. The focus in the residency is on naturopathic primary care. And so it's a little bit of a mix of being, a very straightforward primary care physician while also having patients come to see you for more, quote unquote, indie specialty visits. In terms of the work that you'll do during the week, 32 hours a week are direct patient care time. And then you have 8 hours that are, oriented towards more didactic admin time, things like that. Initially, we start you off at seeing patients where you're seeing, one patient an hour, so you're going to see 8 patients a day, but the goal is to get you up to 16. I will say I typically see between 16 and 20 patients consistently, and so we're certainly not short on patient numbers. We see a broad range of clinical cases. And so anything from, acute upper respiratory infections to really complex chronic disease patients that typically, you're going to be in other settings, you might see more in internal medicine doctor's office, but we're doing the work of managing them here simply because we have such low access to specialty care, things like that. We work side by side. So myself, I actually just finished the residency at Family Health Center. So I just graduated from my 3rd year of residency and signed a contract to stay on here. So I'm one of the attending NDs, but there's also Dr. Sarah Acosta-Smith and Dr. Brendan Smith, who are well known in the naturopathic community and are very good naturopathic doctors. Dr. Acosta-Smith is the primary one who you will also be doing clinical rotations with. And Dr. Brendan Smith actually would be doing more of the didactic portion of things because he's strictly admin. He's actually just the chief of clinical quality at the clinics. And so sort of that is the core naturopathic team, but we also work side by side with MDs, DOs, nurse practitioners, physician's assistants. You have staff of MAs and RNs that you work with. So a really integrated clinical type setting. Next slide. So this is just a little bit more about sort of where the clinics are located. One thing is that the clinic, we have 6 different medical sites across the county, and 4 dental sites. We also have integrated pharmacy and behavioral health within the clinics. So all really great resources for our patients. Next slide. And then the Brewster clinic is the one that Dr. Acosta-Smith is primarily based out of. And so that is theoretically the one we're going to be doing most of your at least initial clinical rotations. It's a very diverse population. We work with uninsured, underinsured, Medicaid, and Medicare patients. And especially in the Brewster clinics and other, what we call our South clinics because of where they're located in the county, we have a very high Hispanic or in Spanish speaking population. It's certainly not required that you speak Spanish, but it would be of benefit if you do. Otherwise, we have translating services to use. And then, across all the clinics, like I mentioned earlier, you're going to be working with an integrated team of various providers, which has been really wonderful in terms of co-managing patients. But looking forward to talking with any of you in the breakout sessions and answering more questions. Thanks.
Awesome. Thank you so much. All right. We are ready for Fern Valley Natural Health.
Hi, I'm Dr. Lauren Riccio at Fern Valley Natural Health. I am the clinical site director. We are located in Bellevue, Washington. If you could go ahead and next slide, please. Great, and you could go ahead and next slide as well. Perfect. Thank you. I am a naturopathic doctor and licensed midwife. Although I am not currently attending births, I am still very connected into the local midwifery and childbirthing community. I've been practicing for 20 years and I've been training residents for probably just as long. We are also one of the AANMC Residency sites, which provides additional opportunities for CE and resources and rotations in other clinics as well. So we are a true family practice. We are an insurance-based primary care, and we have an administrative team that will be doing all your insurance contracting and billing, so you don't need to worry about all of that, but absolutely we will train you on the business side of things as well. We see likely about 50% pediatrics, including newborn care. We are really largely serving people in the childbearing years, so working with fertility, pregnancy complications, contraception, as well as managing issues that could come up with newborns, and including specialized care related to tethered oral tissues and doing minor procedures with releasing those tissues in office. You can go ahead and switch to the next slide, thanks. So we are 5 naturopathic doctors and acupuncturists and two lactation consultants. And so we are really providing comprehensive care, and we have meetings every week where we do case discussion to talk about the families that we are serving and try to coordinate care in-house as much as possible. We are looking for a 2-year resident that is wanting to work with families, preferentially, hopefully some pediatric interest, but pediatric experience is not required. We work Monday through Friday. It is a very busy clinic. I would say probably 30 to 32 hours a week of direct patient care with an average of about 10 patient contacts a day. You'd be primarily working with me, but have the option to rotate with the other providers in the clinic and prepare case presentations as well. Our salary is $57,000 with a robust benefits package, which includes access to several subscription-based resources for information, education, and CE. And then in-house, we also have a full dispensary with a comprehensive tincture room where we do lots of custom formulating so that we can really personalize the care that we are providing. We believe really strongly in access to care and serve a very diverse population. We are serving a large percentage of Medicaid, and so we get to be really resourceful and creative with coming up with treatment plans and really helping families to not only provide primary care, but a little counseling and a little social work, and helping the family unit as much as possible. Thank you so much.
Awesome. Thank you. Okay, we are ready for Health for Life Naturopathic Medicine.
Hi, can you hear me? Fantastic, thank you. So this contact page here will give you the information to be able to reach us for our site. You won't see this information again after this particular page if you want to take a screenshot. Go ahead, next slide, please. What you're seeing here is a picture of myself and one of my lead providers for the practice, Dr. Linnea Felton, and I didn't introduce myself, but I'm Dr. Crystal Tellier. I am the founder of the clinic in 2009, so in practice for the last 15 years. We actually have an additional provider that's joined our practice after we had put together this particular PowerPoint. Her name is Dr. Ann Sura. She just newly moved back to the Phoenix, Arizona Valley after practicing in California for over a decade. So we're a team of 3 doctors looking to add a resident to our practice. We have what I would constitute a primary care type practice and really see a variety of patients. I am additionally trained in midwifery, but at this time are no longer accepting clients for home births. But we see really all stages of life from newborns, and actually prior to that, even just preconception care. So back to newborn care, pediatrics, whether it's for well care or sick visits, acute visits, same for adults. We'll have well woman care, well male care, although I'll say predominant is a lot of women and children in our particular practice, but we see all walks even through into geriatric medicine. We are a fee-for-service clinic. We do help support our patients with insurance needs, but we are cash pay. Allows us to spend a little bit more time with our patients, which I deeply value, and our patient base values as well. So there's anywhere from about 8 to 12 patients on any one of the doc schedules at a time. The resident will predominantly be shadowing with me probably about the first 3 months of their residency, and just based on where their skill set and comfort levels are, we'll start to have opportunities, mostly for my acute patients, to start seeing patients on their own. We do IV nutritional therapy in the practice, and so our resident will be responsible for helping support that modality at our practice, in addition to constitutional hydrotherapy that they will be responsible to help support our patients for that particular care as well. Go ahead and move to the next slide, please. Here's a list of the different services that we do offer within the practice. Some of them I've already stated, but I wanted to just highlight that. Additionally, we do a fair amount with bioidentical hormones, whether it's supportive, again, for preconception care, or men and women through transitional hormonal phases, whether it's thyroid, adrenal, or sex hormone supplementation. And then we have a decent amount of menopausal patients that we would support to working with, hormone balancing and support. You'll see that there's a fair amount of standard naturopathic modalities that we include in our practice as well, with detoxification and homeopathy, hydrotherapy, as I had stated. There's a fair amount of clinical nutrition as well as GI support that's offered to all of our patients. And we do offer on-site laboratory services where we draw at the clinic, and there are times that the resident may rotate into that, although we have 2 phlebotomists as part of our staff for the practice. And so we give an opportunity to let our resident work with some of our laboratory processing to learn that aspect of the practice. My goal for really my residents is that when they leave the residency, or if they stay with us, ideally, they've seen a little bit of everything that it is to run a practice. And so they will have opportunities to learn from the front desk and from the manager, so that they're seeing, some of our accounting services and how we handle new patient inquiries, et cetera. And then they will also be, embedded within the clinical care alongside with me. Go ahead, next slide, please. Really, our ideal fit really should be eager to see and try anything, because we never know who's going to walk through our particular door. And we want to make sure that you're willing to learn new things, that you're very focused on the customer care, and that you are a team player, because there's a group of us at the practice that really allow for just a group effort to take care of our patients and their needs. I will have in the Q&A section, or in the breakout section, more information in regards to kind of our salary offering and support with health stipends and accessibility to medical care through the practice as well. There will be some of those benefits that will be listed, because I recognize I'm coming to the end of my 3 minutes. All right, thank you.
Thank you so much. We appreciate it, Dr. Tellier. Okay, we are now ready for Holistic Health Clinic.
All right. Hi, I'm Dr. Julia Miller. I'm the residency site coordinator at Holistic Health. We've been serving the Tacoma, Washington area since 1985, when my father, Dr. Owen Miller, started the practice after graduating from Bastyr. And we have been providing residencies, 1 to 2 year residencies, usually a couple of them. Most years it's 2 or 3 residencies each year since 1999. So we've been doing residencies for quite a long time. We currently have 4 associate clinicians here at the practice, and each of them brings kind of a different style of practice. Each year with our residents, we do offer the opportunity to join our clinical team as an associate clinician. So that's a potential offering post-residency. And we are an advanced preceptorship site, so we do invite student clinicians to come shadow with us prior to graduation from school. Next slide. So we're a primary care focused practice. And so we kind of see anything and everything that people are dealing with. We mainly are focused on nature care, lifestyle modification, diet therapy to prevent, treat, and resolve chronic disease. So, kind of as a byproduct of being in practice for such a long time, we do have the benefit of seeing decades of care of patients using naturopathic medicine to basically resolve a bunch of chronic diseases. And so that's one of the really cool things about working in a clinic like ours. We don't have any sort of major areas of specialty. Kind of, again, we do anything and everything, but there's kind of a list of modalities here. Hormone replacement therapy is quite a lot of our practice. Next slide. So compensation currently starting at $45,000. We do have the option of increasing that salary this next year. We are going to be switching over to a concierge model and hoping to increase our salaries for associates as well as residents. Here's our contact information for our office manager. She's great. Next slide. I just wanted to highlight here some testimonials from our past residents. This is a small sampling of the huge pool that I contacted to get some testimonials from. And it's quite amazing how many people have graduated from our clinic and gone on to be really successful clinicians. It's always really exciting to connect with these people every once in a while to be like, hey, how are you doing? And hear what a great practice they've got going on now. So I think that that's kind of a testimony to our clinic and what we can do for our residents in their future career.
Excellent. Thank you so much. I appreciate it, Dr. Miller. All right, we are ready for Kansas City Integrative Health.
Hi, I'm Dr. Jansen Roberts. I'm the residency director for Kansas City Integrative Health. I am also a former resident. I was the first resident at the site, and I've completed a 2-year residency and have now transitioned into associate position. Next slide, please. We are located in Overland Park, Kansas, which is just south of Kansas City metropolitan area. Kansas is still a very growing area for naturopathic medicine, and so lots of opportunities in our area. And I can talk to you a lot about the Midwest and the awesome place that it is, but I'll save that for the Q&A if anybody has any questions there. So this upcoming year, the residency is going to be a little bit different from the past 3 years. In the past, it's been a general naturopathic focus, but this year we are going to turn the focus more on women's health and fertility. It is a high need area in Kansas, Missouri area. The majority of the training will be with Dr. Laura Ruse. She's been practicing for almost 10 years with the primary focus in women's health and fertility. So we'll be working with you to hone in your expertise on treating and managing most of the women's health issues, which I've listed there, as well as working on just fertility assessment, and working on preconception care, understanding the different causes of infertility and treatments, as well as understanding the IVF and IUI process, using naturopathic medicine, TCM, acupuncture to improve the success of IVF. You'll also have training in natural or in general naturopathic care. We do want you to be a well-rounded provider. We don't have just you only see one type of patient in our clinic. We want to make sure you're leaving our residency being able to see any sort of patient, but have a little more expertise in the women's health and fertility. Next slide, please. So with our clinic, our program mainly involves direct patient care, very hands-on experiences. We kind of start off with your shadowing and getting used to the clinic, and then we're integrating you into direct patient care. We believe that hands-on is the best way to learn. So very structured guidance into becoming a confident doctor on your own. I can kind of speak towards in my first year, I think by the end of the year, I saw close to 600 patients. So we're busy. We're moving through plenty of patients, plenty of opportunities. I managed their care, had the opportunity to review with directors to make sure that I was competent and confident in what I was doing, and then learning how to then implement those treatment plans. And then that transition into an associate was very streamlined, very smooth, because we slowly transitioned into more and more on your own and everything. Our clinic, we do have 5 in-office naturopathic providers. We have 2 telehealth providers, and we have an acupuncturist. So you get exposure to multiple providers that are more than willing to kind of teach you and answering questions and lend support along the way. Very collaborative environment. And then in our office, we do emphasize functional testing, nutrition, botanical herbs, the basics with naturopathic medicine. Dr. Laura Ruse does have training in the traditional Chinese medicine and acupuncture, so you'll also get exposure to that. Expectations for our residency, obviously it'll be the patient care. It is a full work week, and we do provide specific clinic hours for patient care as well as admin, but then you are also required to participate in grand rounds, extra preceptorships, and writing a paper as well. We are looking for residents that are highly motivated and self-motivated learners. We don't like to micromanage. Our goal is for independent learning so that we can just guide you into more and more independence. We definitely want somebody who is communicative, not only open to receiving feedback, but is also able to express their needs back to the supervisors. We are still a growing clinic, we're still a growing residency. So we want to make sure that along the way, we're making changes that are needed as well. We want to become kind of the long-term residency program. And obviously we want you to have a dedication to women's health and fertility care. Next slide. So I didn't put in a specific slide about compensation or pieces like that. I'm more than happy to answer those questions in the Q&A. But otherwise, if you have any questions, please feel free to reach out. We're happy to hear from you, and hope you come visit our clinic to get a little more information.
Awesome. Thank you so much, Kansas City. All right. So let's see. We are ready for Minneapolis Integrative Medicine Center. All right, Minneapolis Integrative Medicine Center, we have you on. If not, we'll see if we can get them to present later on in our time together. So I'll go ahead and push the slides forward, and then we'll try to get our doctor on in a little bit. Okay, so Montana Whole Health, we are ready.
Hi, can you hear me okay? Hi, my name is Dr. Erica Crumbeck. I am the founder and owner of Montana Whole Health. I'm also the founder of naturopathicpediatrics.com. So as you know, as that sounds like, it's going to be a pediatric focused residency. We do a lot of postpartum health as well. In fact, we really are passionate about treating that dyad of mom and baby. And then we also see families for all ages. Salary, I'll go through that first. It is a 2-year residency. First year salary is $52,000. We do offer quarterly bonuses based on productivity as well. And then we have that pretty significant jump in salary in the second year. We offer all sorts of the benefits that I think you guys are used to as well. And then we're pretty tech forward business. So we do offer the AI scribe, which is really helpful for charting as well. You can do next slide. We are located in beautiful Missoula, Montana. This picture was taken at a hiking place that is 10 minutes from our office. Missoula is a wonderful outdoor lover's dream. I mean, I'm very passionate about Missoula, so hopefully anyone else who comes through the residency loves the outdoors. It's not really a place to be if you don't like the outdoors. We are on the Community Medical Center campus. We're the only naturopathic clinic in Physician Building 3, and we're right across the hospital, right across the parking lot from the hospital. So we're pretty well integrated in a conventional medical community too. Next slide. Again, this is a family residency and mostly in pediatrics. The first year residency is really primary care focused, acutes, newborn visits, all of those things. And then the second year residency is when we're going to expand to see more chronic medical conditions, things like ADHD, failure to thrive, anxiety. But I will say for our resident this year, she's picking up on those quickly just because the demand for those topics is pretty high. Second year resident will also focus on fertility as well. We do have a very strong botanical medicine emphasis, and we're actually looking for a candidate who has an interest in botanical medicine. Do I have one more slide, or is that my last one? Okay, great. Well, I'll say all the rest then. So we are a NERC residency site. That means that the resident has the opportunity to work with several conventional medical colleagues as well, including an observational shift inpatient with an MD inpatient pediatric hospitalist. There's other rotations with the birth center here in Missoula, with another primary care clinic with MDs, and actually another primary care clinic within the other hospital system that Dr. Stiegmeyer, another naturopathic doctor, is working with too. And a couple other things. So we expect the resident to see patients here at Montana Whole Health for about 4 days a week. And then the other half day a week is in these observational sites, and about a half day of admin. We see about 7 to 10 patients per day. We're not excessively crazy. I'm not expecting an 80-hour work week for my resident. We like to work hard and play hard when we're off. So really 40 hours a week is what we're expecting, and not much more than that. There will be some opportunity to learn more about online business revenue too, working with naturopathicpediatrics.com. And I'm happy to answer any questions in our Q&A or breakout. So I think that's probably it for me.
Awesome. Thank you so much. Montana Whole Health. Okay, so now we're ready for Prototype Health.
Hi, I'm Dr. Jamie Kupperman. I'm the founder of Prototype Health, located in Tempe, Arizona. Next slide, please. So we are a nonprofit organization. We were founded to ensure that all patients have access to high quality, affordable, integrative health care. The vast majority of our clients are living below federal poverty level. They do not have health insurance of any type at all. So they do not have Medicare, Medicaid, state insurance, private insurance. The majority are low income, and we work on a self-pay basis. We operate it on a sliding scale based on income. And like I said, our goal is to make sure that integrative naturopathic medicine is affordable for everyone. We see over 1,000 unique patients per year. We see over 4,000 office visits per year. We are a busy clinic, speaking to the need that we fulfill in our community. We do primary care, birth through geriatrics. The only thing we don't do is pregnancy care, but before and after, whether it's family planning or preconception care, we do that, and then we see them after they deliver. Next slide, please. So these are just some basics about the salary. That's pretty standard, but what we're looking for, next slide, please, is someone who wants to work with us. We don't just want someone who wants a residency, although that's a perfectly valid reason for doing a residency. We want someone who wants to give back to our community as much as they're gaining from it from the residency. Unfortunately, we do require someone to be English-Spanish bilingual currently. At least 60% of our clientele are Spanish only speaking. And although all of our providers and staff are, and although one can use translation services, something does get lost in the translation, and our clients really appreciate the one-on-one care and speaking directly to their providers in their native language. You do not need to be natively fluent, but you do need to be fluent to apply for the residency. It's a full-time position. Like I said, we do a full spectrum of primary care. and a full spectrum of naturopathic interventions. So whether that's medical nutrition, herbal medicine, supplements, acupuncture, IV therapy, we're also hoping to build a biofeedback, neurofeedback program in addition to conventional care. And that's what I have to say about us. And I hope I see some of you in the breakout session.
Excellent. Thank you so much. Appreciate that. Okay, so now we're ready for Purity Health.
Hi, my name is Amy Fitzpatrick, Dr. Amy Fitzpatrick. I'm speaking on behalf of Dr. Ryan Young, who is getting ready for an unexpected surgery. So I'm here to talk a little bit. I practice at the Purity Health branch in Washington. She's looking for a resident for the Purity Health branch in Kalispell, Montana, which is also a beautiful, wonderful place. Dr. Young has been in practice and practicing naturopathic medicine for 20 plus years. She's an amazing practitioner. I've been with her for 7 years and have really grown as a practitioner, and she provides a great mentorship experience. You will be focusing on primary care, but you'll have your opportunity to really kind of focus in on your passion, whether it be pediatrics, women's health, autoimmune. She sees a primarily women's health and family care, and helps with cancer patients. And you also have the opportunity to travel to Washington and shadow along and work with the 3 doctors, including myself. I see a lot of pediatric patients. One of the other practitioners specializes in mental health, and another one in environmental medicine. She's really looking for somebody that is, can you go to the next slide, please? Is eager to build their own practice. There'll be opportunity. You'll have your own office, and you'll have a lot of FaceTime, one-on-one FaceTime with her. She's the only practitioner currently in the Kalispell office. So really working to build your own practice. You'll probably see anywhere from 8 to 10 patients a day, building to that, with the opportunity to see more. I have grown my practice to see about 16 to probably 24 on a really busy day. So you will, can you switch to the next slide? Thank you. I can talk a little bit more about the compensation, and she didn't include that in the slide here, but you'll also have the opportunity to learn the insurance side of things, the billing, the management, and ordering labs and aesthetic laser machines. You have the opportunity to learn that. And she really wanted to emphasize that this will not be a glorified medical assistant. You will be practicing as a primary care physician. So thank you so much.
There's one more slide if you want to.
Yeah, just Kalispell's awesome. I've gotten to visit it 3 times, I think, in the last 3 years, and it's just a wonderful place. There's lots of opportunity. It's growing a lot. There's a lot of people moving there. So naturopathic medicine is really in high demand. And so it's a great place to plant roots. And there'd be the opportunity to join the practice. She's really looking for that too. So if it was a good fit.
Awesome. Great to hear. Okay, thank you. And we're ready for Seattle Integrative Oncology.
Hi, everybody. My name is Chad Eshton. I am the originator of our program. I came out of Bastyr University and did a residency at the Cancer Treatment Centers of America in the Chicago area. And that's ultimately what our residency was kind of grown out of or born from. We are in Seattle, as the name implies, but we also see patients further north by about 20 miles in Everett, and then further south about 60 miles in Olympia. We, of course, don't require residents or even any of our doctors to be at all of those locations during any given week. In fact, we've kind of split it out so that we have a few doctors who are focusing more between Seattle and Everett, and then Olympia and Seattle. That makes our clinic, I think, or our residency a little bit different or unique from other programs, although there are some incredible programs that are being presented here today. I'm really impressed by so many of them. Ours is a private practice in Seattle, and then a hospital-based program in both that Everett and Olympia area, where we see patients in the Providence cancer programs. We're right on site with medical and radiation oncology, and in one instance, we're right in the hospital organization, or right there on site of the hospital campus. That allows us to be a truly integrative site where we operate side by side with those other professionals, as well as many other healthcare practitioners. Specific to our clinics, we have naturopathic medicine, of course, acupuncture, massage therapy, and then we integrate with each of the other providers in the hospital sites, where our residents specifically have opportunity for rotations that you'll see there on the bottom of the slide: medical oncology, radiation, surgical, gynecological oncology. So our residents often get to observe surgeries during the course of their education. We also work with pathologists, radiologists, laboratory medicine, and so on for quite a lot of different rotations. And then we really pride ourselves in having our residents go off to other naturopathic programs to spend a few days or even a week with other naturopathic providers, so that we can sort of cross-pollinate, if you will, our education and how we serve our patients. A little more about what makes our program unique is that we are curriculum driven. We have worked with the FABNO, or the naturopathic oncology community, essentially to write the curriculum for a 2-year residency program, which is a pretty robust program. And then our scope is in Washington state. So we have essentially an unlimited scope, with the exception of controlled substances. So we write for labs, we write for prescription medications, we order images, and so forth. I think that's everything for this slide. Let's go to the next one, if you would, please. Yeah, so it's nearly 10 years in the making. We're 5 physicians across our sites. We have some great staff support, probably like every residency here. Go ahead and give us the next slide, if you would, please. We are pretty dedicated to giving back to our organizations, or participating in our organizations. Dr. Erica Joseph is currently the president of the ONC-ANP. A number of our staff have been a part of the ABNO board, which is the professional fellowship board. I've been involved with the state board of naturopathy, which is not the association, but rather the Department of Health arm that's related to naturopathy, setting policy and disciplinary matters. I've also been involved with the AANMC for a number of years. I've already mentioned those 3 locations. Our compensation is going to be really similar to what you've seen here. Also, our clinic requirements are going to be very similar. We don't have a slide on that, but we do a 4-day clinic week where residents and our physicians will see anywhere from probably 8 to 16 patients a day. We have a 1-day administrative day, or for the resident, it's primarily a didactic day. We do not require on-call, although there's occasional after-hours requirements for communicating with your patients as they send messages through our electronic health record system. We have CNME allowance. We have tumor board attendance. Residents are given the opportunity, not frankly required, but have the opportunity to co-present at different conferences throughout the year, Oncology Association specifically, and occasionally for the Society of Integrative Oncology, which goes beyond the naturopathic profession. We have a progressive sort of responsibility program where residents are really in observation for the first 3 months and then get more and more responsibilities. We do see about 5% of patients that are non-oncology. And as you might imagine, so many of our patients have comorbidities. So you'll be exposed to diabetes, cardiovascular disease, autoimmune, HIV, complicated neurodegenerative diseases, with your patients that have a cancer presentation.
And hi, Dr. Chad, we have just a couple more seconds left, okay?
Yeah, and similar. So the last thing I guess to mention would be that similar to many of the other residency programs, we have an opportunity for residents to join our practice afterward if it's a good fit. And we'll look forward to answering questions that you might have in the breakout session. Perfect. Thank you.
And just to show you, this slide also shares a little bit about schedule and patient load for Seattle Integrative Oncology. So if you're watching this, feel free to take a picture of this if you want to review it. And then definitely, as you just mentioned, go to the breakout room if you would like more information about this slide and the ones that he shared earlier. All right, so we are ready for Stark. Thank you.
Hi, my name is Dr. Alice Nguyen. I am the Director of Naturopathic Medicine at Stark. It is a fully integrated fitness, medically supervised fitness facility with a team of strength coaches, chiropractors, health coaches, and personalized one-on-one training. Next slide, please. So these are the conditions that we typically see. We have a very unusual population where we actually see about 60 to 70% men, and the rest 20 to 30% women, depending on the location. We do have 3 locations in Southern California with plans to expand across the country in a 50-state licensed model, being led by an MD or a DO supervisor at the very top. So these are the conditions that we typically see: cardiometabolic, autoimmune, endocrine. But again, men's health is actually what we see. There is a very small percentage of regenerative injection therapies that we do see. And in fact, I am the only one who's doing that since I have had the most training. And our residents will actually be learning the basics of medicines, foundations of medicine, before they can be considered for that. So you can see the modalities there. If you can go to the next page, please. So our again, mentioned earlier, patient population is mostly men, very unusual in the naturopathic kind of community, primarily between 35 to 65 years old, although we do have the oldest patient we have here is 83 years old, so that's pretty fun. Very highly motivated C-level executives and their families. So on average, our doctors will see about 20 to 30 patients per week. We spend a lot of time with each of them. And in addition, we do see our patients on a more regular basis because we have a fully equipped gym attached to every single location. So IV therapy is done here as well, usually for more immune support and sometimes metabolic or at least mitochondrial support. And usually our initial visits are 60 minutes with follow-up visits to between 30 to 60. And we do follow our patients very frequently, 3 to 4 times a year when it comes to comprehensive testing. Next page. Might be, gotcha. So these are our benefits: health, dental, vision, 401k matching after 1 year. We hire with the expectation of the doctor being with us for as long as possible. So we're very, very tribe oriented in our company, and we want to keep the best candidates for as long as possible. So this is not something where, you know, they learn for a year and they leave. We try our very best to keep our doctors. So there is, of course, a potential for professional growth. We will be expanding to other locations, and the doctors are, you know, the residents. The goal of the residency is to place those doctors in the future locations as their head doctor. Our compensation in the state of California, there is a white collar minimum. And as of 2024, that salary will actually be $67,000 a year. We also have ancillary benefits, which include one-on-one personal training, chiropractic care, which is mobility and soft tissue, you know, ART, as well as personalized nutrition plans. So the doctors actually go through the Stark process as if they are a paying client themselves. So the retail value of all of that is about $25,000 in addition to their salary. So again, we try to keep our people as best as we can. So I think that's it for me.
Awesome. Thank you so much, Stark. We appreciate that. All right. And now we have Tandem Clinic. We're ready. Thank you.
Hi, everybody. I'm Dr. Carolyn Yukai, and I'm coming to you from the beautiful Vancouver, British Columbia area in Canada. So I'm representing today for Tandem Clinic and our residency program. You can sort of progress through the slides however you see fit. You can probably go to the next one now. So we just provided some background information about myself and Dr. Lynn Clausen, who is the owner of the clinic and the founder of the residency program. So our residency is rooted in general medicine and primary care, but has a specific focus or emphasis on tick-borne illness and Lyme disease and complex chronic illness. So both myself and Dr. Clausen, you know, through our own schooling, we're really frustrated by the lack of attention to Lyme, tick-borne illness, and how this sort of relates and is very prominent in the setting of complex chronic illness, which is why Dr. Clausen spearheaded the development of the residency. I was the first resident to complete the 2-year residency, and now I'm also a supervisor and the clinical education developer as well as supervisor. So the expectation is that our resident is already confident in the basic general medicine primary care skills. So you will be seeing your own patients right from the very first week, although it'll be in a sort of structured, mentored sort of setting. But we do want candidates who have specific interest in Lyme disease and complex chronic illness. And there will be some specific training in this area sort of built throughout the residency and progressing to you seeing your own complex chronic illness patients. So the ideal qualities of our residents, you can probably go to the next one now. We want some research experience, especially where, we have a lot of data. We see a lot of Lyme and complex chronic illness patients. So we want to be working on publishing case studies to really build the evidence base for what we're doing. So some research experience would be really ideal. We want you to be a self-starter. We want you to be highly motivated, detail-oriented, empathic. These patients have been through a lot in the medical system. So that's a very important quality for us. As well as a good team member. So we're trying to sort of move towards more of a team-based care model for availability for the patients, a little to reduce sort of burnout from an individual practitioner perspective as well. And we've found that this works really well in our clinic. So the team right now is myself and Dr. Clausen. So those are the predominant clinical supervisors at this point. We also have a resident with us right now who's happy to answer questions as it relates to the resident experience. And then I think more specific structure related questions can come in the breakout sessions, but just in general, our approach is really a hybrid approach. In British Columbia, we have a very wide scope of practice. So we do a lot of prescription therapies, a lot of IV-based therapies, and a lot of just basic naturopathic therapies and recommendations that really have a lot of momentum. So that's the basics, and I'm happy to answer more questions in the breakouts.
Excellent. Thank you so much. All right. So what we're going to do now, well, first of all, just before we get into our breakout sessions, here's a quick slide with how candidates can get more information about residency and how to get started. Definitely recommend getting started sooner rather than later. Get your questions answered now, get started now, preceptor, ask questions to sites that you're interested in. And right now is going to be a great opportunity for that. We also have some upcoming AANMC events that I wanted to share with you. You can find them on our website and register there. The main one that I really want to direct your attention to is on Sunday, January 28th. This coming January is going to be at 2 p.m. We have our virtual Q&A session for phase 2. So we'll have residency directors there, the folks from the different schools that run, that supervise the residency site. So we'll just go over expectations for phase 2